Morning everybody. I'll show some few clinical examples, then Rizwan will teach about anatomy. This is a patient who had a fall a few months ago prior to imaging and complained of persistent pain and stiffness since then. As you can see, there is a breach in the scaphoid bone and a diagnosis of scaphoid fracture was done. So I will just show some examples and we'll go through the anatomy, what are the common fractures and how does the fracture look and what are the complications related to fracture. So this is a classical example of fracture which is non-unioned. That's a scaphoid fracture. Another example, a patient with a fall again, but if you look at both the images, there is a focal uptake there. So if you do only spect or nuclear medicine scan, there will be a focal uptake in the carpal bones, but to accurately localize, you need some CT correlation or an. There's another patient. This is the hamate bone. As you can see, that's the hook of the hamate, and there is a breach here, and there's a fracture with non-union. Another example, a patient with again extended arm, fracture involving the triquetral, and there is a fracture line, and there is also pseudoarthrosis. It means to say that it is not fused together, and this is an example of a non-united triquetral fracture. Another example, a patient with history of fall 3 months ago, MRI of the right wrist showed some mild triangular fibrocartilage complex. That's the commonest site they get injured. And spect CT was helpful to show the specific diagnosis where there is increased uptake. And that was a classical example of a TFCC injury, which Rizwan will expand in his anatomy. What are the commonest injuries on that side of the arm, especially in the ulnar component. This is again a soft tissue type of injuries. You can see the two-phase bone scan is relatively normal, but on the spect, as I showed previously, there is increased uptake, which is a soft tissue injury with persistent stress. You get what is called as an ulnar impingement syndrome.